Level 1, the pre-med. You are 18 years old. You declare a biology major. You enroll in organic chemistry. It carries a nickname across every campus, the Weeder course. By the end of the semester, half your lecture hall has changed majors. You learn to recite reaction mechanisms out loud. You learn to shadow a trauma bay without looking away. You learn to find a vein on the third try. You learn to read a rejection letter without stopping. You log volunteer hours at a free clinic on Saturdays. You take blood pressure readings. You watch a physician place a chest tube between two ribs. You watch a code called after 11 minutes of compressions. Nobody explains the silence that follows. You sit the MCAT. 7 hours and 30 minutes. 4 sections. Chemistry and physics. Biology and biochemistry. Psychology and sociology. Critical reading. No outside knowledge allowed. The scale runs from 72 to 528. Fewer than 1 in 1,000 test takers hit a perfect score. You do not. You submit your application through AIMCAS. You write secondary essays for 14 different schools. You fly to interviews on money you don't have. 3 rejections arrive first, then a 4th. A patient from the free clinic misses her follow-up appointment. The one who let you practice sutures on her arm. You call the number on file. It's disconnected. Nobody at the clinic knows where she went. One acceptance letter comes in October. You have not touched a scalpel on a living patient. You have not opened a body that still had a pulse. You already know not every story gets an ending. You choose a school. Orientation starts in 9 months. Level 2, the med student. You are 22 years old. You walk into the anatomy lab. 4 students per table. 1 donor body per table, someone who signed their body away before you were born. You are handed a scalpel for the first time. Your hands sweat through the gloves. You learn to identify the brachial plexus by touch. You learn to trace the femoral triangle. You learn the names of 11 cranial nerves in order. You learn to keep eating lunch after lab. You sit through 6-hour lecture blocks. Biochemistry pathways. Pharmacology tables. 2,000 slides a week, some professors say more. Your flashcard deck climbs past 1,000 cards. You practice histories on standardized patients, actors trained to fake symptoms. An examiner scores your bedside manner from behind a one-way mirror. You forget to wash your hands once. It costs you points. You study for USMLE Step 1. Since January 2022, the exam reports only pass or fail. No number attached. The old passing mark was Un-96 out of 300. You still study as if the number matters. Programs still whisper about it. You lock yourself in a library carrel for 6 weeks straight. You stop answering texts. Test day. 8 hours at a computer testing center. 40-minute break windows. You don't use them. You don't eat. A classmate 2 carols down withdraws from the program the week before your exam. Nobody says why out loud. Her nameplate stays on the door for a month. You pass. The score report says 1 word. Pass. 3rd year starts Monday. You trade the lecture hall for a hospital badge. Level 3, the sub-intern. You are 24 years old. 6-week rotations. Surgery, internal medicine, pediatrics, obstetrics, psychiatry. A new team every month. New names spiced to memorize by 6 Fs. An attending fires questions at you on rounds, faster than you can think. The residents have a name for it, pimping. You answer wrong. He moves to the next student without a word. You learn to present a patient in under 90 seconds. You learn to hold a retractor without your arm shaking after 2 hours. You learn to write a note before you've eaten breakfast. You learn to guess which attending wants an answer. You learn which one wants silence. You sit USMLE Step 2, seek. Numeric score 1 to 300. No pass-fail cushion this time. Programs read this number closely now. You submit your residency application through ERAS, one of the most competitive matches in the country. You rank your programs in order. The programs rank you back. Neither side sees the other's list. Match week. Monday, 10 a.m. Eastern. 1 yes or no message tells you if you matched at all, not where. You matched. You don't know your program yet. You wait 4 days. Friday, 12 p.m. Eastern. Every applicant in the country opens the same result at the same minute. Over 50,000 people refresh a screen at once. You get your program name. You start screaming before you've finished reading the city. Your closest friend in the cohort studied with you every night through Step 2. She doesn't match. She sits alone in the stairwell. You're still celebrating. You don't know what to say to her. Orientation for interns starts in 10 weeks. The badge in your hand still says student. Level 4, the intern. You are 26 years old. White coat ceremony. You're called doctor for the first time. On the wards, you're still the lowest rank in the building. You carry a list of 40 patients on a folded index card. You update it every 4 hours. You write a progress note for each one before rounds. You learn to place a central line under the collarbone. You learn to read an arterial blood gas in under a minute. You learn which senior resident answers a 3 a.m. page. You learn which one doesn't. You learn to suture straight on 4 hours of sleep, 80 hours a week. No more than 24 hours straight. The legal ceiling. Written into national policy in 2003. Before that, interns worked shifts twice as long. The rule traces back to an older case. A resident on hour 30 of a shift. A misdiagnosis. A patient who died within hours of admission. You rotate through the trauma bay. Advanced trauma life support. It's the protocol for the first hour after a gunshot wound, a car crash, a fall. You call a code blue for the first time. Chest compressions at 100 beats a minute. You count out loud. The team needs to hear the rhythm. You take your first solo overnight call. A patient's blood pressure drops at 2 a.m. You page the senior resident. Your voice shakes on the phone. You sit the AB site. The in-training exam every resident takes every year. Your score gets ranked against residents nationwide. You don't ask what your percentile is. Your first patient dies on your watch. An elderly man. Bowel obstruction. His heart stops responding to compressions after 20 minutes. The attending calls the time of death. You're the one who has to tell the family in the hallway. A senior resident catches an error on your order sheet. 10 times the correct dose. It never reaches the pharmacy. You don't sleep that night, even off shift. You survive intern year. 365 days logged. Next year, less supervision. More decisions with your name on them. Level 5, the junior resident. You are 27 years old. Rotations broaden. Vascular surgery. Transplant. Trauma. Endoscopy suites you'd never entered as an intern. You perform your first appendectomy as primary surgeon, not assistant. An attending stands across the table, hands folded, watching instead of guiding. Your hands don't shake this time. You rotate through the surgical ICU. You manage a ventilator without a second thought. You manage a central line without checking landmarks twice. You manage a code blue, calling the shots yourself. You manage a trauma pager, moving before dispatch finishes the sentence. You take trauma call overnight. Gunshot wounds. Motor vehicle collisions. A stab wound to the abdomen at 4 a.m. You're the first scalpel in the room. Your case log passes 200 logged operations. Procedure, role, complexity, all tracked. The American Board of Surgery will ask for this list one day. Your ABSITE score posts online, ranked against every general surgery resident in the country. Yours drops 12 points from last year. You don't tell anyone at work. A trauma patient arrives with a ruptured spleen. You follow every step by the book. You control the bleeding. You pack the wound. You call for more blood. He dies on the table anyway, 40 minutes in. The attending tells you some patients don't survive correct technique. You miss your sister's wedding. Your pager goes off during the rehearsal dinner. You're in scrubs by the time she cuts the cake 3 states away. A co-resident in your class transfers to another program mid-year. Nobody explains why. Fewer of you left for senior year now. Level 6, the senior resident. You are 29 years old. You run the trauma team on call, senior rank now, not backup. You triage 3 patients arriving within the same 10 minutes. You send one to the OR, one to the ICU, one to observation. Nobody reviews your calls before you make them. You assist attendings on hepatobiliary resections, vascular bypasses. Cases junior residents aren't allowed to touch yet. You teach an intern to close a fascia layer. You teach another to tie a one-handed knot. You teach a third to place a chest tube between 2 ribs. You teach a fourth to stop shaking during a bleed. You consider fellowship, cardiothoracic, trauma surgery, surgical critical care, oncology, transplant, colorectal, pediatric, vascular, plastics. 9 subspecialties. Each one more years added before independence. Some residents in your program take 1 or 2 research years between clinical blocks. You decide against it. Every extra year delays independence further. Your case log crosses 400 operations, hepatectomies, bowel resections, trauma laparotomies, vascular repairs. Your wife goes into labour. You're scrubbed into an emergency bowel resection. Your co-resident covers your pager. You make it to the hospital 90 minutes after your daughter is born. You missed it by 90 minutes you can't get back. Chief resident selection happens next spring. The program director reviews 5 years of evaluations, case logs, ABSITE scores. 1 categorical spot. Several candidates. Level 7, the chief resident. You are 30 years old. Final year of training. Ultimate clinical responsibility now, under attending supervision only on paper. Your case log crosses 1,000 operations. 5 years of counting. The number matches what your program director told incoming interns to expect on orientation day. You supervise every junior resident on the service. You supervise every student rotating through. You assign the cases. You decide who operates. You decide who retracts. You learn to run a service of 30 patients from memory. You learn to pull a resident from a case without raising your voice. You learn to call a family meeting at dawn. You learn to sign as attending of record before you've passed boards. 48 weeks logged in the chief role. The minimum your board requires before you're even eligible to sit the exam. Every Friday, morbidity and mortality conference. Every complication, every death presented to the entire department. Your turn arrives. A bowel perforation missed on a scan, you read yourself. You stand at the podium. You name your own mistake out loud. These residents will compete against you for attending jobs next year. You take the final absit of your training. Last comparison against your peers before real board exams replace it. A trauma patient crashes on the table under your hands. No attending scrubbed in. You call it. Time of death, your voice, your decision alone. Residency ends in June. Fellowship match results already came back in December. You know where you're going next. Level 8, the fellow. You are 31 years old. A separate match apart from residency. The specialties matching service. It's run its own fellowship match since 1984. Colon and rectal surgery was the first specialty to use it. You match into trauma and surgical critical care. Narrower training now. Deeper. The most technically demanding years of your career, senior surgeons tell you. They're not exaggerating. You scrub in on cases residents never touch. Damage control laparotomies. Vascular shunts placed under fluoroscopy. Organ procurement runs at 3 a.m. You race cold ischemia time. The clock starts the second a donor organ loses blood supply. You learn to pack an open abdomen for a second look surgery. You learn to read a CT angiogram before radiology calls back. You learn to run an ICU code without backup. You learn to sign off on withdrawing care. You published 2 papers this year. Case series retrospective review. Your name goes on the fellowship market alongside them. Academic centres want publications. Private practice groups want case volume. You're building both at once. A liver arrives for a patient who's been waiting 11 months. Cold storage clock already running. Transport delayed by weather. The organ crosses the viability window by 40 minutes. You call it non-viable yourself. The patient stays on the list. You still answer to an attending. Still not fully independent 9 years after your white coat ceremony. Fellowship ends in June. Academic centre, private practice group or community hospital. 3 offers already on the table. None of them final yet. Level 9, the attending. You are 34 years old. Board exams first. The general surgery qualifying exam. 8 hours, roughly 300 multiple choice questions, one sitting, once a year in July. You pass. The certifying exam next. Oral boards. 3 sessions, 30 minutes each. 12 cases total, 7 minutes per case, 2 examiners watching your reasoning out loud. You pass this too. Diplomate status arrives by mail months later. Your name goes on the OR schedule alone for the first time. No attending standing across the table. No one above you to call at 2 a.m. You build a patient panel. You negotiate hospital privileges. You take call 2 nights a week, on top of a full clinic schedule. You learn to close on your own timeline, not someone else's. You learn to fire a scrub tech who doesn't meet your standard. You learn to tell a patient their cancer is inoperable. You learn to sit with a family after telling them. Your malpractice premium arrives every January, higher each year. General surgeons face a 50 to 60% chance of being sued by mid-career. Close to 3/4 by the time you're past 55. You get served papers for the first time. A bowel perforation during a routine cholecystectomy. A known documented risk of the procedure. Depositions for 8 months. The case gets dropped. Your name stays in a database anyone can search. You work 55 hours most weeks. You miss your kid's school play twice in 1 semester. A resident you once supervised gets recruited to a rival hospital. They offer more money than you make. You mentor the next one anyway. A chief of surgery position opens in your department. Your name comes up in the search committee's first meeting. Level 10, the chief of surgery. You are 58 years old. You run the department now. Every all block schedule crosses your desk. Every hire, every termination, your signature at the bottom. Your hands carry the decades. A faint tremor in your right index finger, worse after a 12-hour case. Hearing loss in your left ear, high frequencies gone first. Decades of bone sores and monitor alarms did that. Your back seizes if you stand at a table longer than 3 hours straight. You learn to read a hospital budget line by line. You learn to sit across from a malpractice attorney without flinching. You learn to deliver a termination in under 5 minutes. You learn to walk into a board meeting knowing your department's numbers are down. A surgeon 12 years younger than you gets courted by a hospital 2 states over. You recruited her yourself years ago. Better equipment, better pay. You counter the offer. It isn't enough. She leaves in March. The hospital board reviews your department's malpractice history at the annual meeting. Premiums up 18% this cycle. Your name is one line in a much longer spreadsheet. Mid-procedure on a case you've done 400 times. Your hand shakes on the needle driver. A resident notices before you do. You finish the case. You don't take another one that week. A formal review board convenes. Standard procedure after a complication rate flagged by the quality committee. 3 physicians you trained sit on the panel. They vote to restrict your OR privileges pending a competency evaluation. You clean out the office that had your name on the door for 11 years. Your first case log. Handwritten from intern year. Water-stained. Barely legible. You walk past the resident locker room on your way out. Likely the last time. A first-year resident sits alone on a bench, trembling. Staring at a pager that hasn't stopped buzzing all night. Same hallway. Same tremor in the hands. You don't say anything. You just watch for a moment the person you used to be. The cycle continues.